Is it visible now?
Yeah, you can continue.
Okay. So, yeah. So, cervical cancer is the fourth most common malignancy among women worldwide, and radiotherapy is one of the techniques that is used for its treatment. Radiotherapy includes external beam radiotherapy as well as brachytherapy for the treatment purposes. The goal of radiotherapy is to deliver optimal tumoricidal doses to the tumor and minimize the dose to the normal tissues surrounding the tumor. And there are various advanced radiation therapy techniques used for the treatment of cervical cancer that have significantly improved the treatment outcomes as well. Now, radiotherapy, as explained earlier, is divided into two categories, external beam radiotherapy and brachytherapy. In external beam radiotherapy, we have conventional techniques, 3D CRT, and advanced techniques like IMRT, VMAT, and IGRT. In brachytherapy, we have two types of techniques for the treatment of cervical cancer. It's intracavitary brachytherapy and interstitial brachytherapy. Now, when we talk about external beam radiotherapy, which is EBRT treatment technique, first we'll talk about conventional techniques for the treatment. So in conventional techniques for the treatment of cervical cancer with EBRT, generally X-ray images or orthogonal images are used, and it is based on the treatment is based on the bony anatomy as well as the clinical judgment of tumor location and extension. So the planning of the treatment of the patient is done with the help of bony landmarks and the anatomical structures which are visible around the tumor with the help of contrast agents. For example, barium may be used to visualize small bowel or lower extent of disease in the vagina. Now, further, when we talk about conventional techniques of treatment, then the conventional techniques of treatment involved the beams which are placed in anterior posterior direction as well as in posterior anterior direction. So in this figure, we can see in figure B that this particular radiograph, it covers the borders of the volume which we want to treat. So it is represented by the field borders which we want to irradiate with the help of radiation. So this is a conventional method because here the field borders are based on the bony landmarks used. Similarly, in this figure, we have two radiation beams which are passing through part of the patient as well as the posterior part of the patient. While in the other image, we have around 4 radiation beams, anterior part, posterior part, as well as lateral radiation beam, which are irradiating the tumor volume. So in conventional techniques, usually the bony landmarks are used for deciding the radiation field, that which area has to be irradiated so that the tumor volume gets covered. So if the patient thickness is less than 20 centimeter, only 2 beams are sufficient to cover the tumor. And if it is like greater than 20 centimeter, then around 4 fields are required to cover the tumor volume. Now coming to the next EBRT technique, which is 3-dimensional conformal radiotherapy. So 3-dimensional conformal radiotherapy involves use of 3D imaging like CT images. So 3D anatomic information is used for planning the treatment of cervical cancer patient. And it is called as conformal technique because the dose around the tumor, it conforms well to the tumor volume and gives less exposure to the surrounding volume. So in 3D conformal radiotherapy techniques, the beam direction and beam weight is chosen based on the trial and error method. And then the plan is optimized based on the our desired coverage criteria. That is how much radiation has to be given to the patient so that the normal tissues are spared as well as tumor receives the sufficient radiation dose. So in this figure, this is an example of a 3D conformal radiotherapy patient plan. So we can see that in figure B, the field borders are there, but these green color line represent the conformity. That is, the multi-leaf collimators are surrounding the tumor volume, and the tumor volume will receive the radiation which is just conforming to the radiation. So the radiation will unnecessary part of the soft tissue or the normal tissues will not get exposed, and the radiation will be confined to this part of the tumor volume, which has been contoured on the CT scan. So like in this CT scan, we can see this red color contour is the PTV, which is the tumor volume, as well as this cyan or blue color represents the nodal area. So we're irradiating the nodal as well as the primary tumor volume over here, and with the help of two beams. But like I said, if the patient thickness is higher, then around 4 radiation beams are required, 2 lateral beams, as well as 1 anterior and posterior beam. So this represents the AP, that is anterior posterior part of the beam, and this represents the lateral view of the patient, that the beam is fired when the beam is fired laterally. So we can see that the radiation is conforming well to the desired tumor volume. Now let's come to the more advanced techniques of the EBRT, which is IMRT, intensity modulated radiotherapy, and volumetric modulated arc therapy. So the previous techniques, which is 2D conventional technique and the 3D conformal technique, had limitations. That large volume of normal tissues was irradiated, which led to severe acute and long-term complications like gastrointestinal, hematological, and genitourinary complications. And moreover, it was difficult to deliver high doses to the region, the tumor region, because of the risk of recurrence. So that is why, because of these limitations, more advanced techniques of treatment for cervical cancer were used. They have come up, which is intensely modulated radiotherapy as well as volumetric modulated arc therapy. And these treatment techniques have shown reduced treatment related toxicities as well as improved survival for cervical cancer patients. So IMRT is a technique which helps to deliver the complex dose distribution of target and facilitates the rapid dose fall off outside the target volume. So in IMRT plan, multiple non-coplanar beams are used for IMRT treatment. And what we do is that we set our desired criteria, objective criteria, that we want our tumor volume to receive this much percentage of dose, and we want the normal tissues to be confined to their tolerances, that the dose should not cross the tolerance of the normal structures around it. So this process is achieved with the help of optimization of intensity of the radiation. And after the optimization process is complete, the dose is calculated by a treatment planning system. So this entire process of treatment planning is done with the help of a software, where our goals are decided, that tumor should receive this much percentage of dose and normal tissues should not exceed their tolerances. So multi-leaf collimators are used to modulate the intensity of treatment field while IMRT plan. And patients are treated to the dose of 45 grain 25 fractions, or 46 grain 23 fractions, or 50 grain 25 fractions for cervical cancer patients. This is a typical IMRT plan of a cervical cancer patient, where the tumor volume has been delineated, which has been shown with red color contour. So we can see that around this red color contour, we can see this distribution, the dose distribution, how the radiation has been distributed, and it is well conforming to the tumor volume like this. And there is less spillage of this radiation dose outside the tumor volume. So with the help of IMRT, as we can see in the figure, we are able to spare the normal tissues to a greater extent. So these are multiple beams that have been placed at different angles when the patient is on the treatment couch. Then comes the image guided radiotherapy. Image guided radiotherapy is basically a method in which frequent imaging is done for the patient prior to the treatment as well as during the course of radiation treatment. And the purpose is to position the patient properly and with an accuracy, so that the treatment position of the patient is comparable to the pre-therapy imaging from the treatment plan. So the goal of IGRT is to improve the accuracy of radiation field placement and to reduce the exposure of healthy tissues around the radiation treatment. And it is recommended along with IMRT and VMAT to limit the dose to the surrounding tissues and ensure the safe delivery. Most commonly used IGRT treatment involves electronic portal devices followed by KV and MV cone beam CT. Now we come to the second technique of radiotherapy, which is brachytherapy, which is used for the treatment of cervical cancer. So in brachytherapy is a technique to deliver radiation at short distance using an encapsulated source. Here sources or radioactive sources are placed close to the treatment volume, and it can be delivered in a different way. For example, it can be used uh, as intracavitary brachytherapy in cervical cancer. But in cases where intracavitary brachytherapy is not feasible, interstitial brachytherapy can be used for the treatment of cervical cancer. Iridium 192 and cobalt 60 are the popularly used sources for the treatment of cervical cancer. So intracavity brachytherapy is a technique where sources are placed in body cavities. This technique uses specific applicators which are inserted in the uterus and vagina to deliver high dose radiotherapy by creating a volumetric dose distribution around the tumor. Intracavity brachytherapy can be used either solely for the treatment of early stages of cervical cancer or in combination with the external beam radiotherapy for locally advanced cases. So, since a very high dose to primary cervical tumor and relatively lower dose to nearby structures can be delivered with the intracavity brachytherapy, a better local control and less toxicity can be achieved using ICBT. Now, interstitial brachytherapy is a method where radioactive sources are implanted directly into the tumor tissue. So, where we cannot use intercavity brachytherapy, interstitial brachytherapy plays an important role. So, for example, in cases like medial parametrium and bulky tumor, which is greater than 4 centimeter, or recurrent disease, interstitial brachytherapy is a good choice. Now we come to the two-dimensional image-based brachytherapy or two-dimensional intracavity brachytherapy. So two-dimensional intracavity brachytherapy is based on the use of orthogonal radiographs, which is used for treatment planning in brachytherapy. And applicators like Fletcher-Williamson stainless steel applicators consisting of two ovoids. So this is a figure of a Fletcher-Williamson applicator where there are two ovoids, this one left and right, and in center here is a tandem which is placed into the uterine cavity, and these two ovoids are placed into the vaginal fornices for the treatment purposes. And the radioactive source will move through this applicator to deliver the radiation to the tumor. So, like I said, that orthogonal images are used for the planning purposes here. So, in intracavity brachytherapy, the tandem is inserted in the uterine canal and ovoids are placed in vaginal fornices. In the OT, after the completion of application, treatment planning of patient is done on the anterior posterior. This is the anterior posterior image, and this is the anterior posterior image, and this is the lateral image or the lateral radiograph. And the treatment planning is done on these two images. In the treatment planning system, a dose of around 7 gray per fraction for 3 fractions is given to the patient. And like we see, that this is the dose distribution which is obtained in frontal view as well as in sagittal view. So we can see this red color line around the applicator. This represents our 100% dose around the tumor volume. But there are limitations of two-dimensional ICBT. And the limitations are that the target cannot be delineated because it is based on orthogonal radiographs where we cannot appreciate the tumor volume. Secondly, the image, since it's a 2D based treatment planning, only point doses can be visible. And the volume, since the volume of organs or the nearby surrounding structures is not visible, only point doses to these structures, the normal organs, can be decided, and this is insufficient to predict the toxicities of the structures around the tumor. So there was a need to go for three-dimensional image-based brachytherapy, which is based on the 3D images like CT and MRI. So 3D images have already replaced the two-dimensional image-based brachytherapy. And because with the help of 3D imaging, we can assess the tumor volume and also delineate the organs at risk or the normal structures around the tumor volume. In this figure, this is the tandem and this is the ovoid. We can see clearly the applicator on CT images. And this particular, the curves around this applicator, they represent the isodoses or the radiation, which is in the form of a pear shape, which is surrounding the applicator, and it is delivering the dose to the tumor volume, which is cervix area, which is irradiated by this applicator, as the radiated source will move around this applicator inside the applicator and irradiate the tumor volume. So this entire planning process of the treatment is done with the help of a treatment planning system where the organs at risk are contoured as well as the target is contoured, and our calculation algorithm will calculate the dose received by the organs as well as by the tumor volume. So in summary, radiotherapy will plays a significant role in managing cervical cancer with the standard mode of definitive treatment in locally advanced cervical carcinoma. External beam radiotherapy, along with brachytherapy, is the standard treatment for cervical cancer with FIGO staging 2B to 3B. And the most common brachytherapy technique used is intracavity brachytherapy. But in cases where intracavity is not feasible, we can go for interstitial brachytherapy. The toxicities of radiotherapy vary according to the grading system and duration of follow-up, method of calculation, as well as the treatment method used. So, so basically, to conclude, radiotherapy it plays a major role, is an essential pillar of treatment of cervical cancer, and mostly it is solely either we can treat with brachytherapy or we can combine external beam radiotherapy with brachytherapy to treat the cervical cancer patient. Thank you so much.